So I am the head of the Department of Obstetric and Gynec, and I am working in CMP Homeopathic Medical College, and I have a vast experience of treating gynec as well as obstetric cases, which is very rare to be managed with homeopathy. We have a full-fledged, we had rather, it's now really in a last 2 years it's been in a bad shape, but earlier we had almost more than 1,500 deliveries a year happening in our hospital, and whenever medical part of the treatment used to be advocated, we used to chip in as a homeopath. Surgical part, as you know, surgical part is a part by itself, you know, where we don't have much scope. But yes, I have been fortunate enough that we had such good setup, and I have learned whatever I have learned in my college. Okay, so let's start with the first slide. I think first topic we'll start with is PCOD. Let's start with a very interesting definition. It is defined by one of my teacher, who is no more now, but he was a well-known gynecologist, and by the definition itself you will know that it is a definition given by a male doctor, not a female. Yes, next slide. So what is the definition of a woman? There are multiple definitions. One is she is a biped who micturates once a day, who defecates once a week, who menstruates once a month, and who parturates once a year. It's a very uncharitable and a politically incorrect definition. All the females out here definitely will agree with me. We don't belong to that definition anymore. But there is a big but out there. Why am I saying but? Physiologically, it's a very, very true definition. Whenever females have been postponing menstruation by the ways of occipils or preventing pregnancy for whatever reasons and not allowing that natural function to take place, that is going to amount in increase in a gynecological disorders. If you are aware, PCOS is increasing. I think Dr. Venkataraman must have talked to you. Now 1 in 5 females in Bombay has some sort of endocrinal problem. 1 in maybe 20 or 30 patients may suffer from fibroids in India. Very, very common. If you get the sonography done of all 30-year-old patients, at least 10 to 20% of them you will find having a fibroid. It may not be symptomatic, but this gynecological conditions or diseases are increasing when we don't look at the physiological function of the female. Next please. Now I think the history has been mentioned to you. I was not aware that he is going to take about PCOD. So I have mentioned little bit about the history. I think he has mentioned to you about the Stein-Leventhal syndrome, who was the first guy somewhere in 1935. He realized that there is a raised LH levels, that is luteinizing hormone, and with that the patients were presenting with oligomenorrhea, anovulation, hirsutism, infertility, oligo-ovulation, that is again anovulation, and recurrent miscarriages. I think all the terminology has been explained to you yesterday, but we will go through it little faster. Next please. So PCO is usually thought to be a lifetime female hormonal imbalance, where the maturing eggs fails to be expelled from the ovary, creating an ovary filled with immature follicles, somewhat misleadingly called cysts, and this cyst then contribute to the hormonal imbalance, and this causes more cysts. So it's a vicious cycle. Multiple cysts are formed, they are not maturing, they are remaining in the ovary, they keep secreting estrogen, that increases the LH levels, the FSH levels remain low, it doesn't ovulate, and the cycle goes on. Patient remains amenorrheic, patients have oligomenorrhea, and if there is a breakthrough bleeding, then patient can have episodes of menorrhagia. So that's a very, very vicious cycle. Next please. I think this also you have been taught. 60% of all anovulation women will have PCOD, 92% of all patients with idiopathic hirsutism. I hope you know what is the difference between hirsutism and viralization and hypertrichosis. They are very, very similar. What is hypertrichosis? It's a genetic inheritance where a female has in general more hair all over the body. It is genetic. It has nothing to do with the terminal hairs being very prominent, which happens in PCOD. While in virilization, It is a male pattern. So, baldness, and she gets a hoarseness of voice, or she has reduction in the breast size, and that is a male like feature, that is viralization. So, this is how little difference between hirsutism, hypertrichosis and viralization. 22% of all normal female volunteers were found to have PCOD. Very, very strange, which was not the case 20 years back. I am seeing gynec patients only in the OPD. There once in a full moon, once in a new moon we used to say one case of PCOD. Now I am seeing almost 1 in 5 teenagers in the age of 15 to 25 coming with PCOD. Very, very increase in the cases of PCOD. Nearly all patients of PCO have irregular cycles, and 1/4 of them, remember that is very, very important. Not all of them will have all variations. Some will present with only sonography finding. If you get investigations done, FSH and LH ratio, which is suggestive of PCOD, when the LH is more than 3 times to that of FSH or 2 times. Ideally speaking, normally FSH and LH are equal, 1:1 ratio. But when a patient goes into PCOD, or where there is a full blown picture of PCOD, the ratio is reversed. LH to FSH is either 2:1 or it is 3:1. So, but that also is not seen in all patients. Only 1/4 of the patient will have this altered FSH and LH ratio. So, the picture can vary. Patient can present with menstrual irregularities, patient can present with So, basically it is a hyperandrogenism with chronic ovulation, that is the symptom totality of PCOD, and all the symptoms are explained because of either hyperandrogenism or it is because of chronic anovulation. There is one more thing which is added now, and that also has come in last few years. I think Dr. Venkataraman must have talked to you about Heron Syndrome. Can anyone tell me? You have just had a lecture yesterday. What is Heron Syndrome? You have a pen or something? Heron Syndrome, H-A-I-R-A-N Syndrome. You just had a lecture 24 hours, not even 24 hours. H-A stands for hyperandrogenism. I-R stands for insulin resistance, and A-N stands for acanthosis nigricans. That's a thickening of the skin. No, it's okay. Hyperandrogenism, insulin resistance and acanthosis nigricans. So, that is a full form of Heron Syndrome. Okay, so that is what I wanted to tell you, that few patients will present with this altered FSH-LH ratio. Next please. Presentation, I think that also has been done in detail with you yesterday, but I wanted to